Hi, it's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health. And this is your monthly wellness update. Today is July 1st, and luckily information isn't swirling around and changing minute by minute like it used to. So hopefully by the time you're watching this, the information is current and relevant. We're only going to spend a little bit of time on what's going on with COVID right now. But I would like to talk with you about the questions we're getting around two very significant kind of post-pandemic trends. And the first is long COVID, and the other is the emotional and mental health toll that this has taken on all of us and that you may have been noticing within your work site. So I'm going to quickly share my screen. We will go to the DHEC site, and you can see that they're reporting their data in a little bit different way now, which is really interesting because you can set your date range and look at this in any way that you would like. But what I want to do is head down here and let's look at the course of COVID cases since this started in March 2020. You can see here this blip right at the beginning of the summer was the one that shocked us and put us all into quarantine for longer than we thought. And then right over the holidays and into the new year, we had that huge surge. Then we saw our Delta surge in the fall, and then look at this Omicron surge that just blew us all away, right? So while cases have been going up recently, this puts into perspective what we've been seeing. And the sentiment here is that, or the feeling here is that while we are seeing an increase in cases as we have new variants hit the scene all the time, that our immunity from previous infections and immunity from vaccines are keeping those a little bit lower. Now let's talk about what might be on the horizon. We do know that the Omicron COVID already has multiple variants that we've seen. This one was caused by Omicron A1, maybe a little B2, or excuse me, B1, maybe a little B2. Now we were seeing a lot more B2 and a little bit of B4 and 5. So what that tells us is that this virus is still mutating. We have not seen really high uptick numbers in hospitalizations and deaths, which is good news. But we are starting to see some preliminary data that previous infection and vaccines may not be as effective against B4 and 5 as they were against these other variants. Now, that doesn't mean not effective. It just may mean not as effective. So it is still the best course of protection to get a vaccine. Okay, that's still the recommended best way to try to keep you from getting so sick from COVID that you end up in the hospital or dying. Now, as we see mask mandates lifted, not a lot of people are wearing masks anymore. Certainly we're not isolating, we're back to large gatherings. The other half of this coin, or the other side of this coin, is that detecting cases as early as possible is going to be our other mitigating strategy. So in your workforce, it's very important for you to set up an environment where folks are feeling willing to get tested when they have symptoms. We know that there's some reluctance and we're all kind of over COVID and don't really want to know anymore. But that's the other way to mitigate the cases, is to know when they're happening and then to know when someone needs to quarantine or isolate. There's a really nifty tool I want to share with you regarding isolation and quarantine. So the CDC has developed this quarantine and isolation calendar, and oh my gosh, how wonderful is this? We no longer have to memorize all the rules. You're certainly welcome to call me, as you always have, to kind of run those cases by me. But now you can click here, and this chat box is going to take you through the various scenarios. So you can see here, you can click either that someone tested positive or had close contact. Let's say they had close contact with someone. They did not have confirmed COVID within the past 90 days, so they've not had a previous infection in the last 3 months. Let's say they're up to date with their vaccines, and then you enter in when they were exposed to that person. Let's say it was yesterday, okay? And then it's going to tell you what the recommendations are. In this case, because this person is fully vaccinated, because they were exposed to a COVID positive person, they do not have to quarantine unless they develop symptoms. It does talk about when they should get tested. So you can run through various scenarios using this calculator. It's fantastic, and really does factor in some of those gray areas that you and I have talked about in cases that can be difficult. So use this tool to help you with that. The last thing I want to talk about here is with vaccines. And so many of you may have heard that vaccines are now recommended for those 6 months and older. So Moderna and Pfizer have been given EUA approval for those kiddos under the age of 5 but over the age of 6 months to get vaccinated now. Now we know our children have in South Carolina have traditionally not been the group that has the highest rate of vaccination, but for those of you who have yourselves or have workforce members who have young children, this is great news if they're interested in getting them vaccinated. Of course, you can scroll down and find out exactly who should get vaccinated when. In general, it's still a two-dose series for the mRNA vaccines with boosters at 5 months and somewhere between 4 and 6 months after that first booster, you can get a second booster as an adult. There are also options for a third shot in the primary series for those who are immunocompromised. So if someone may have actually gotten 5 COVID vaccines, and we're still waiting to hear what's going to happen in the fall. Are we going to have new vaccines that are targeted against the Omicron B4 and 5 variants? Is this going to become a seasonal endemic type of illness like flu? But again, let me reiterate that our new mitigation strategies are identifying folks with COVID and getting them into isolation so it doesn't spread, and vaccination. All right. People have been asking me about travel restrictions or now no restrictions. So you may have also heard that it is no longer required for folks coming into the United States to have a negative COVID test. So if you have folks who travel for work, they no longer have to take a test over or set up a doctor's appointment outside of the US before they can come back in. Leaving and going to another country is going to be very country specific. So I've given you here this travel page for the CDC, and essentially you have to look up whatever country you're headed to and find out what their regulations are in terms of having a negative test or proof of vaccination before they travel to that area. And of course, you've probably heard that masking is no longer required on mass transit. In the US, that can be different in other countries. So just be sure you check to see what other countries' regulations are. Of course, domestic travel, no concerns there. All right, let's move into long COVID. So I'm getting a lot of questions about how to manage long COVID. This is tricky, but let me just start by saying that conservative estimates say that about 1 in 3 folks who have had COVID will suffer from long COVID symptoms, meaning that someone who's had COVID may have fatigue for well past 3 months since their infection. We're seeing this up to folks at this point, since we've got lots of time now in this pandemic, even up to a year after the infection. They may have trouble breathing. They may have cough. They may have exercise intolerance. They may have what we call COVID brain, where they just feel foggy. They can't concentrate. They can't focus. There are folks who are having mental health disturbances as a result of their infection. That's separate from the psychological trauma of the pandemic. Kidney problems, muscle and joint problems, sleep problems, you name it. And it's probably higher than 1 in 3. Probably most folks are feeling some long-term sequelae from their long COVID. What's difficult for you all and for physicians to tease out is whether or not those symptoms are a part of long COVID or are due to something else. And so if you're concerned or you have an employee that's been missing a lot of work or who maybe is struggling at work because of their symptoms following an infection, enlist us. Please let us answer your questions. Have that person see their primary care physician. If they don't have one, we can help set them up with one so that if an evaluation can be done to be sure that there's not something else going on. I know that this can cause increased absenteeism and decreased productivity for some of your workforce. And so it's important to be educated around what can happen with long COVID so that you do understand a significant number of your folks who have been out with COVID are going to have some limitation for a little while. So here's a resource for you. Certainly you can go through here and see it's just amazing how many symptoms can linger from a COVID infection. Now, one thing we have noticed is that long COVID tends to happen more often in folks who had more severe disease, but that's not always the case. In fact, we've even seen folks who had no symptoms of their infection, had a positive COVID test, maybe had an exposure, knew they had COVID, but didn't really have symptoms or had extremely mild disease, and then 3 months later are still struggling with maybe shortness of breath or exercise intolerance. And so here again, you can scroll down, find out some more information how to live with long COVID. What I love about this page is that it does send you to some resources that you can hook your employees up with to help support them through this awful journey. Here you can see another resource for you called Caring for Patient with Post-COVID and Conditions. We talk about children and adolescents. But I think the most important thing for you as employers is to understand how prevalent this is and to begin to have open conversations with your workforce or members of your workforce who may be feeling bad. You may have some folks who are very vocal about how they're feeling. You may have some who are kind of keeping it under wraps. But one thing that we've noticed about our people with long COVID is that many of them don't feel heard or understood, and many of them don't feel like it's psychologically safe to say, yes, I'm still struggling 3 to 6 months later for fear of any kind of ramifications from that. So it has to do with managing stress, in other words, stress on the body, but also emotional stress as well, and then how to support. So listen with compassion, really talk to folks about how they can gain understanding, and then determine how you can help with what they need. Again, we can help with that, but I want to share with you one more resource here that I think is really amazing that you can use while you're having conversations with these folks, or that you can have folks walk through so that they can find resources to support them. And what's nice about this tool, it's called the How Right Now, is that it walks people through their very specific personal feelings. And this also bridges the next topic we're going to talk about, and that is the emotional and mental health issues that we've been noticing as this pandemic has begun to wind down are not going away. So again, another kind of chat box function here, algorithm function here. So you can have someone fill this out with you or walk through this with you or on their own. But let's say someone is feeling stressed, okay? That's going to take them to the next box, coping with stress, and it's going to give them a whole bunch of resources around how to manage that. It's going to give you a bunch of resources on how to manage that. You may have someone who's having financial stressors, someone who's fearful for their physical health because they are at risk of consequences for COVID. There's someone who may be feeling angry because of loss of function. They can no longer breathe when they're going up the stairs. And so all of those pathways will lead you and your employee to resources. We have resources for you too. So let's talk about this mental health piece. I want to show you something. So this was data that was gathered from multiple sources around the stress that the pandemic has caused and how often folks are now feeling anxiety and depression. So you can see here, this dotted line is the percentage of folks who had anxiety, depression, or both in 2019. Look what the numbers have done over the last 2 years in 6 months in increments, okay? So we're talking about tripling, quadrupling the number of people who are experiencing true anxiety and depression as a result of numerous things that have happened over the last 2 years in their lives. So to ignore this element in your workforce is not going to get you anywhere in having a productive, happy, healthy workforce that doesn't turn over. So given that we've got such a high incidence here of folks who are struggling, we have really answered that charge. So please reach out to us about our resources. We have a new program called MindWell, which is for folks who may not feel like they need counseling or an employee assistance program initiative, but would love to talk about coping strategies and overall well-being. And we address everything from financial wellness to social wellness to environmental wellness to mindfulness, you name it, over multiple weeks in multiple 1-hour sessions. We've been doing this here with our own team members at Prisma Health and have gotten amazing feedback about our MindWell program. I also do resilience talks and how to manage burnout, how to cope with stress. That can be a workshop. It can be just a lunch and learn. We can tailor that to whatever you need. And we also have longitudinal curriculums around building resilience and managing stress that we can do where we dip in each month. We can work with work units individually and find out what challenges they have in particular, given their sort of common, daily routines and stressors and challenges, and tailor a program for a work unit within your workforce so that they can promote a culture of well-being and pull themselves out of any anxiety, depression, stress, worry, anger, grief that they may be experiencing. Of course, also utilizing your EAP is very, very important. We have a wonderful vendor that we work with, LifeWorks, that can work with you if you do not have an EAP program. They are wonderful, especially for more of an elevated touch point of care and short-term counseling. Don't forget that we have health coaches that can also work with folks not only around their physical health, but also around their emotional health and how to cope with stress, and importantly, how those two things are linked. So a very comprehensive approach to whole being wellness. And we also have nurse practitioner services. Now they can see folks for episodic care, but they also do well visits, health coaching, nutrition coaching, stress coping strategies, you name it. And one of the wonderful things about our health coaches and our nurse practitioners is that they can also navigate into additional resources that may be useful for you, your work, and your workforce. I am going to share before I go one tip of the month. This was something that our director of operations shared with me. And when you look at the research, it turns out that organizations that do really well in promoting their well-being programs are targeting the head of the household that handles the healthcare for that family. The research shows it's typically the female spouse. And so your tip for today is to think about what your resources are, where the gaps may be, and reach out to us and find out how we can help you fill them, and then market that to who you think is making the decisions for your employees and your workforce. The last thing I'm going to share with you today is our webpage so that you know how to reach out to us. Here we are. You can scroll on down. These videos are here if you'd like to look back at them, but please give us a call. Let us know what you need. Let us know what you're thinking. Let us know what your questions are. And again, as we move out of worrying day to day about COVID infections, keep in mind the best mitigation strategies are knowing who has an infection and keeping them isolated until they are no longer contagious, encouraging your employees to get vaccinated. We can certainly help you with vaccinated clinics. Being open to talking about long COVID and understanding that it is a true phenomenon that can be debilitating for some, and plugging folks into resources to help them feel supported, as well as their primary care physicians so that they can get the treatment they need. And then finally, understanding that we've got an exhausted, stressed, a little bit broken workforce out there, and that just because the pandemic has slowed down, those types of issues are not gone in many of our employees. And so use that how right now tool to find resources. Use us to find resources. We would love to work with you on a mental health and a resilience building curriculum. In the meantime, know that we're here to take care of you so you can take care of your workforce. And I'll see you in a couple months.